Sure. I'm from the US. I studied occupational therapy and started working at a hospital in Florida. And shortly after working there, an oncologist approached our department and said he had a lot of women who developed lymphedema in their arm after breast cancer. And this was in 1998, said that there is a training, something called manual lymph drainage, with this bandaging technique that he has seen throughout his travels in Europe, and he knows it to be very effective. So someone from the department should go get trained. I was lucky enough to be the one sent. So it was the Vater School, so it was 4 weeks long of training, 160 hours. I came back to the hospital, started this program, and it was like from the beginning, I knew right away this was like great stuff, because you get these patients who come in with this tremendous swellings, whether in the arm or the legs, and the results spoke for themselves. So I, after about 2 years working there, I decided this is really my passion. This is what I wanted to do full time. And I started my own business. And so I
Oh,
had
wow.
my own multidisciplinary, eventually it grew to, there was 8 therapists. We had a multidisciplinary practice in near Miami, between Miami and Fort Lauderdale. And it was, in addition to the lymphedema, it was with wound care as well, because in the States, physios, occupational therapists, and nurses, we all work together as a team, and it is within our scope of practice to do wound care there. And so, yeah, so then I was there until 2012, and that's when we moved to South Africa, and originally in Durban. And when I initially came, there was there was there was a certification training here that had been going on with a collaboration with the University of Western Cape. And then the year I started doing trainings, 1-day workshops and trainings, just explaining what lymphedema was to healthcare professionals. And through that exposure, I spoke in Johannesburg, Pretoria, Durban, here in Cape Town. A lot of the practitioners said, well, we want to get more training. So again, I was always at the right place at the right time,
Yeah.
and decided I would go back to the States and become a certified instructor, and then came back here and I launched Lymph Africa Education back in 2015.
Right.
So that's my background, and how I came to be here in South Africa and doing the trainings here. I'm
Wow.
passionate about educating all healthcare professionals about this condition and the
Okay.
treatment available for it.
Right. And I mean, it's from what I understand, obviously working in the lymph sector, we supply garments, a light a class 2 garment. So we never, well, I personally don't really get to see the patients. You know, I deal mainly with the therapists. So I mean, how prevalent is this condition?
Well, it is a disorder of the lymphatic system. It's a condition that can develop. Again, there's 2 different types. So there's primary lymphedema, where someone could be born with a dysfunctional lymphatic system, and that could be either at birth, it could start at around 2 years old, or of course it could start at any time in childhood, or primary lymphedema can also start occurring in a person's, when they're 30 years old. They start to develop swelling. Usually in women during pregnancy, the swelling just never goes away. And then there's secondary lymphedema, which is an acquired lymphedema, which occurs because of a trauma or an injury, lymph nodes removed, or surgery or radiation, which is what we see a lot of. And so yeah, it can occur for a multitude of reasons. Also, people with any type of surgery, with swelling or edema that hasn't been controlled, and it just continues to get worse and worse and worse. At some point, it's not just edema anymore. It's now can be termed as the lymphedema. So it's any swelling that just doesn't go away within 6 months could be termed lymphedema.
Right. So other than primary lymphedema, it is effectively brought on by an environmental condition, or
yes, or an injury or surgery or radiation. Yeah.
Right. And I mean, treatments, what are the different kinds of treatments that are available out there? Is it only compression therapy, or?
So the gold standard is something called combined or complete decongestive therapy. And this treatment, and this is the therapeutic treatment that I train physios, OTs, nurses, doctors, and orthotists and massage therapists how to do. So the combined decongestive therapy, the pillars of it is there's four pillars of the therapy. It's manual lymph drainage, which is a very light skin manipulation and massage of rerouting the fluid from the swollen area back through the lymphatic system into healthy lymph node areas where the body naturally drains the fluid out through urination. So manual lymph drainage is one. Then multi-layer compression bandaging to keep the swelling down from each treatment, from one treatment to the next, getting the swelling down. After the bandaging, the patient, or while the patient's bandaged, the patient should be doing exercises and movement and walking and just muscle, compression and pumping to help move the fluid out of the limb. And then skincare, or just making sure that the skin is moisturized, that the skin is intact, there's no wounds, there's no breaks in the skin, because that could be an area where you're at risk for getting infections.
Right.
And then the other components that I specialize in as well, and I like to add additionally, is diet and nutrition. Nutritional, keeping a patient should keep a journal, understanding that everything they eat can affect anything. Certain foods or drinks can affect how much fluid they're retaining. And so
Right.
A patient may think they're eating a healthy diet because they buy their food at Woolworths. But in fact, some of those foods, say even a packaged soup may be very high in sodium. So
Right.
anytime someone's eating too much sodium or preservatives or, MSG or chemicals, it can make the body retain fluid. And so, yeah, that's an important component. And then kinesio taping, like elastic taping, is a really nice adjunct to therapy. There's also different types of compression pumps that you can use in addition to the therapy. And then nowadays there's even laser and low-level laser and different modalities in addition to the traditional treatment.
Sure. Well, it's quite an extensive list of therapies available. Huh?
Yes, there's a lot. And then in addition to that, so once if the therapy has been successful, but the patient just has so much edema or the edema is reduced, but now there's still this adipose tissue that's left, they may be a candidate for the debulking or liposuction surgery that is now available here in Cape Town with Dr. Laura Redman. And I've been intimately involved with trying to grow that program, with letting patients know about it and that it's available here in South Africa. Other surgeons and plastic surgeons, of course, can do it as well and do a debulking. However, our program is unique in that we followed a protocol from a doctor, a world-renowned surgeon from Sweden, Malmö, Sweden, Dr. Håkan Brosen, who's published extensively on specifically the debulking for lymphedema patients. And the protocol that he does there, we've gone to Sweden and gone through the training to really try to mimic or to recreate that program and his successes here in South Africa. So, and that's where the compression and the importance of the compression and the proper compression of compression garments comes in.
Right. So, with you say debulking, what would the word be? Extensive is the amount of swelling that a patient can go through. Or should I say, how fast is that? Is it like a hyperspeed that the body goes through?
That's a good question. So, every person is so different. And I've seen where, some patients have a slow progression and it just slowly grows, and they go to the doctor and ask for help, and the doctor may not know that there's a therapist available and say, just here's a diuretic and elevate your limb. And then the limb keeps getting bigger because no one told them to wear compression. So it could be a slow progression, or in some cases it does progress quite quickly, and adipose tissue does develop, can develop within a few months. And other times it could be over years that the limb just keeps getting bigger and bigger. And some patients at a certain point, that's as big as it gets. But then the therapy that we do always is effective with getting down a certain amount of edema. And with some patients it reduces the edema back down to almost normal, or sometimes normal. It just depends on what stage of lymphedema the patient's in, because
Right.
there's three stages. Well, there's a knock stage. So any patient who has had cancer surgery or radiation or lymph nodes removed is always at risk, lifelong, to develop lymphedema, right? So that's where my push for education is so vital for all therapists and doctors to understand that if a patient is starting to complain of pitting edema and swelling in the early days, rather get it sorted earlier rather than later. Don't wait until it gets worse, right? A
Yeah.
patient should have it addressed soon. And then stage one is when you press in and it's a little bit of indentation, but at night when they go to sleep or they elevate their arm, the swelling goes down completely. Or if they start wearing a sleeve or a compression garment, a compression class 2, the swelling goes down completely, and that's still a stage 1. A stage 2, an early stage 2, is when they still have pitting edema, they press in, it stays indented, but it doesn't go away 100% at night anymore.
Right.
They notice that there's a difference between the sizes of the arm or the difference between the size of the leg. And stage 3, to be classified as a stage 3 lymphedema, is when you start seeing those nodules and skin changes, where there's hyperkeratosis or those papillomatosis, which are those warty projections. And so sometimes a patient doesn't have to be tremendous, but may have those warty projections, so they actually are diagnosed as a stage 3. It just depends on a multitude of factors as to how to stage a patient.
Right. So it's obviously
but it can happen very quickly.
Okay, and it's chronic. Once you've developed lymphedema, it's chronic, and it boils down to treatment and then management.
Correct. So there is no cure as of yet. There is no cure. There's only treatment and management, as you've just mentioned. But that's one of the things with the surgery, the debulking surgery. Dr. Brorson does state that, we actually, with the debulking or liposuctioning out of the adipose tissue, you can virtually bring them back to their pre-lymphedema stage, because you can suction out all of that excess adipose tissue. And then they have a slender limb again. So now, to keep that limb slender, it's super important to have the correct flat neck compression. It's what he's used for over 30 years, and it's a gold standard, and it's tried and true. A lot of patients want to go through the debulking and then say they just want to wear like maybe a compression class 2 garment or a circular knit. But that's a talk for another day, the different types of compression and compression classes and materials and textiles and the level of containment within the garments. And I think that's where the quality of the garment, if someone has a mild stage 1 or stage 0 lymphedema, then the quality isn't, as important. Of course, comfort is the most important thing, because it doesn't matter how expensive or inexpensive a garment is, if it's not comfortable, the patient's not going to wear it.
Yeah.
Right? And so that's where finding the right fit for the patient with the right quality and the right material and the right compression class is super important. Yeah. So there's no cure.
So
management.
I mean, the level of awareness, with it being Lymphedema Awareness Month, how much awareness is out there about what the condition is and the treatments available? I don't see it as it's almost an underexposed disorder.
Yes, we often call it the Cinderella of medicine, because it's just not discussed. And even within the realms of oncology, where you would assume, oncologists and their nursing staff and surgeons and radiation oncologists would be super knowledgeable about it and warn patients. And, there should be a direct link as soon as a patient is diagnosed. Like, there should be a connection with the lymphedema therapist, just to be knowledgeable and educated, and to know that if the beginning stages, if they start getting any swelling, they should be linked up with the therapist. We're still in the infancy stages here in South Africa. But, like I mentioned, I started in 1998, and I think I was one of 300 therapists throughout the country that were certified at that point. Okay. And there's a certification exam called the LANA exam in America. And I saw this industry boom. It exponentially grew there. So when I moved here in 2012, it was like I was blocked back into 1998.
Oh, yeah.
Because there was so few therapists, And the therapists that were here, they didn't have the right products, they didn't have the right support, nobody was talking about it, no one was diagnosing it properly. And so there was this black hole of just, there was so much room for improvement, there was so much room for education, and it was like just an exciting space to be in, to say, this can change, we can shift and educate and make create more awareness. And again, there's still a ton more of awareness available to do. And so, but I think we have made great strides. The Lymphedema Association of South Africa really puts themselves out there and tries to do as much with education, and is a great resource for therapists, for the therapists that go through the certification. And, I encourage every therapist who's gone through the certification course to just go out there and talk, and to do presentations, and to speak to the nursing departments, and to speak to oncologists, and speak to the cardiologists, and speak to the plastic surgeons and the dermatologists. I mean, it really, orthopedic doctors, it crosses upon the path of every doctor's group, GPs. I mean, that's the first line, right? All the patients, when it's 20 years post their cancer treatment, they don't go back to their oncologist. They'll go back to their GP. So it's crucial that GPs are knowledgeable and aware of what this condition is. And it's not just, to know a patient's history thoroughly and then say, that actually might be lymphedema. Why don't I connect you with a therapist who maybe can assist you and guide you further in the treatment. If it's appropriate, you'll do it. And if it's not lymphedema, or if it's something else medical, then we can do further testing. So it's really important.
And are you finding the uptake in people wanting to become therapists? You find it's growing?
I've been doing this since 2015, and consistently we always end up having, as one instructor, I have had co-instructors, but it is growing in the awareness and the interest in it. But usually I run a few courses a year. The first year I ran 5 courses. It was a very hectic year because it's an 8-day training. So it was very labor intensive, and it's full days from 8 in the morning until 6 at night. But is it growing? Yes. The biggest class I've ever had was 24 students. And mainly it's anywhere from 8 to 12 students is the average class size, because it's such an intensive one-on-one training. You really can't have more than that per instructor, because you really want to make sure that the students are getting what they need to get. Teaching the massage, the manual lymph drainage treatment for the whole body, the face, head and neck. And then the bandaging, there's the multi-layer bandaging, which is still the gold standard, but there's so many other options. There's Velcro wraps now, and there's alternative bandaging devices. There's Mobiderm, there's all the different brands, Juzo and BSN and Medi. They have a lot of different variety. Sigvaris, there's a variety of different companies out there on the market now that have amazing products available for patients. So it's a really exciting, growing field here in South Africa.
Oh, fantastic. And you don't need to, do you need to have a medical background to become a therapist?
You do. So that has been really also kind of the gold standard internationally, is you have to be HPCSA registered or within the scope of being a physio, an occupational therapist, or nurse to get medical aid reimbursement. Those 3 professions have billing codes for the medical aids for lymphedema treatment. And in fact, Discovery, there is a national practice register. So once they go through our or any certified lymphedema certification program, they can then submit their credentials to the National Practice Register, and they're listed on Discovery and the other medical aids as a certified lymphedema therapist. And so it is my understanding that unless a therapist is a certified therapist, then they can get reimbursed for the lymphedema billing codes. And if they're not, they get questioned and it might be denied. So that's where the importance, but also just the knowledge base. We go through and really educate on so many aspects of lymphedema care. And even though the course is now 10 days long, I could easily make it another 10 days and it still wouldn't be covering everything and all aspects of all the different types of lymphedema that you can come across. There's just it's a huge field of knowledge and information and research. And it's really exciting times. There's so many new things coming out every day out of Europe, out of America, Australia. The research is just the microsurgery that they're doing now. They're doing lymph node transfers and all kinds of really exciting treatments. And new options for patients.
Right.
So hopefully in the future, maybe our therapy with the massage and the bandaging will become obsolete because they'll have so many new and improved ways to treat it and medically manage it. But at the moment, our treatment is effective, and it's a starting point for patients to at least
Okay.
get some level of relief for their discomfort and to be able to medically manage it. But it is a commitment of time and energy and money for
Mm.
the patient. Yeah.
I mean, with the stuff that does go relatively undiagnosed, I mean, is Joe Public, do they need to be aware of general lymph drainage? Being able to do home drainage? Is there something? Is it something we need to be aware of if we, why do we need to drain lymph?
Well, the lymphatic system is part of your immune system, right? So if you have a sluggish lymphatic system, your immune system isn't working at top capacity. So anytime you have any congestion, it's at risk for developing further problems in your body, right? And that's so having a very healthy, free-flowing lymphatic system. In fact, even if someone doesn't have lymphedema and you're a healthy person, but you're going to go for elective surgery, say a plastic surgery or even dental work,
Yeah.
having lymph drainage and just when we treat, regardless of where the swelling is, even if it's in your foot, we always start at the neck because all of your lymph fluid in your body eventually drains up here in your neck area.
Okay.
So we educate patients how to do self-massage, and we treat in this area, and then again, depending on where you're having problems or where you're going to be having surgery, we would be stimulating the lymph nodes, whether in the axilla or in the groin area. We also go through diaphragmatic breathing, which also helps facilitate lymph flow. And then teaching patients some really simple self techniques. And again, there's a traditional way of doing manual lymph drainage, which is a very slow and light stretching and a releasing of the skin. It's a very light technique. If someone's saying that they have pain with manual lymph drainage, it's probably not the medical therapeutic manual lymph drainage, because you do hear patients who've come from like spas and I don't know what the name of the professionals are here that do that. I don't want to say massage therapists because that's not fair to say. It could be other types of, well-intentioned people who are
Yes.
thinking that they're helping the patient, but actually making their swelling worse. And
Right.
so it's important to, and there might be deeper techniques that are effective, but a lot of times patients come and they're just frazzled and they're like, I got more swelling from this manual lymph drainage they said they were doing to me. So I always put patients' mind at ease that the treatment, that the traditional type of manual lymph drainage should not hurt. It's very slow, it's very light, it's very rhythmical. Most people are very relaxed, and it soothes the body. But there is a modern technique, a modern, more modernized lymphatic drainage, where it is a little bit shorter treatment time. It is more of a stretching and a pulling of the skin, I could almost say, or like sweeping of the skin. And that treatment technique is also effective, but it is a little bit deeper, but certainly should never hurt a patient.
Right. So it sounds like it requires quite a holistic approach to the treatment and management of it. Like you say, from dietary through to gentle massage, gentle, all over body care, and actually understanding what your body's going through.
Yeah, absolutely. I mean, it's definitely a holistic approach of really looking on all aspects of the patient. That's why one of the important, and I've actually moved this portion to the beginning, the first day of the course, is how do you evaluate a patient? What are you looking for? What are you assessing when you're screening or evaluating a patient? What is their past medical history? What have they gone through? What happened in even their childhood? Have they had childhood trauma or accidents or car accidents or sports injuries? Maybe they broke their leg 5 times when they were a kid.
Wow.
So this all affects, how the lymphatic system is flowing. What medications on there? Sometimes medications causes people to swell. Lyrica, just off the top of my head, I had several patients where they're on Lyrica for nerve pain, and we just had the doctors switch them off of that to another medication, and 50% of their edema went away even
Wow.
without touching them. So
Mm.
sometimes it's just about being knowledgeable and knowing the different aspects. But then that being said, also, when you're evaluating, you're making sure that the patient is medically safe to have the lymph drainage. It's not for everyone. It's like, say, if someone is having a congestive cardiac failure and they're having difficulty breathing, their body's filling up with swelling, you would
Right.
probably want to make sure that they're medically managed with their physician and not go forward with treatment with that type of patient. If it's a chronic condition and they're medically managed and it's safe to do it, then you can collaborate and make sure with the doc that it's okay. Another aspect would be if someone has poor arterial flow, you can do the manual lymph drainage, but you would be very, very cautious before you put any level of compression on them. And there would be signs and symptoms of our arterial insufficiency, but we educate on how to do that and how to do an ankle brachial index pressure test to see is there enough arterial flow down to the legs to be able to compress the legs with bandages. So all these things are super important.
Sure. Well, it sounds like you've really got your work cut out for you when it comes to diagnosing and treating. And I mean, I'm sure you build beautiful relationships with your patients over years.
Yes. Yeah, because, well, the treatment is really intensive. I don't know if you've ever spoken to the patients, but in Europe and in the States, when I had my own clinic, depending on how swollen the patient is and how long they've had the lymphedema, if they come in with a stage 2 or stage 3, immediately we would recommend 5 days a week. You're going to come in for an hour of manual lymph drainage, 45 minutes to an hour, and then you get the compression bandaging applied. And it's multiple layers. So it's a stockinette, it's cotton padding, it's finger bandages, it's foam, and then it's the brown short stretch bandages. And there could be 3 to 5 bandages applied. So like they walk out like a Michelin man type person, but all of these layers have a purpose, and it's about containment and getting the swelling to stay under control, but it's also about comfort, and it's not going to hurt them, and it gets the swelling out. And yeah, so it's really important just to manage things properly.
Yeah. And I suppose there's got to be a certain amount, I'm sure you see it with your patients, amount of like social stigma attached to it, because I think originally it was called elephantitis,
Yes.
And
So stage 3 lymphedema is elephantitis. It's still listed as that, like in research papers. So the stigma attached, of course, is like people noticing it is like, oh wow, your one arm's so much bigger than the other, or your leg's so much bigger, or even once they've been managed and the one is still slightly bigger and now they got to wear a compression garment. And there's so many more options now. There's different colors. There's some that are printed with really cool, like tattoo looking things. There's different brands. Lymph Divas is on the market here in South Africa, and so there's a lot more options patients have than they used to. But yeah, the stigma but once a patient is knowledgeable about their condition, and not everybody is confident to talk about themselves or their condition, but I always try to empower patients to say, it's almost, you have this, you didn't ask for it, it happened to you, but now we're going to manage it, we're going to keep it under control, and now that your lymphedema therapist, it's never going to get to elephantitis, right? We're going to make sure that it never gets that way. And I always try to empower patients to share their story with other patients or other people they see in the shops who maybe they are swollen and they don't have a compression garment on, and to just share that, do you know that there's help for you? And it's amazing. That word of mouth referrals is just so powerful, because often we would get patients coming in from, this lady tapped me at the shop and said I needed to come see you. I don't really know what you're going to do, and so I say, okay, you need to go see your doctor first to make sure that this is okay. But yeah, it's the stigma of just knowing that there is help. I think that's my biggest message, is if you've got swelling, there's help.
That's fantastic. Yeah. And I mean, I don't know, are there obviously quite a lot of support groups, that kind of stuff on social media. I mean, Lymph Africa, have you got all sorts of support groups associated with you too?
Yes, yes. So there is a lovely Lymphy Warriors here in South Africa. It used to be the lymphedema. It was something South Africa, but then they edited the name. And those group of women are amazing. And there's a lot of international lymphedema support groups from the States and in Australia. And it's just a really nice resource for patients if they're having questions. But the one here in South Africa is great. And, I always try, if I do get it onto my Facebook feed, I always try to share knowledge and information on there. And all the therapists, most of the therapists who are certified are members of that group. And it's amazing how patients share stories and what's worked for them. So that's been really nice too and supportive. But they do have in-person, obviously pre-COVID, there was people and doctors and therapists who had organized in-person support groups. And hopefully now that COVID is hopefully clearing away and we'll be losing them, or even if we continue with our masks, but hopefully we'll have a resurgence of in-person. Or even with Zoom. Zoom's an amazing resource just to have people be able to share their stories and talk, and like-minded people with the same condition. It's always nice to hear. In the government sector, we have trained several. We give a huge discount. We give a discount for therapists that are in the government sector to come through the training, the certification training. So we have trained therapists at several Johannesburg hospitals. In Durban, I used to do the training at Gray's Hospital in Pietermaritzburg. In the physio and OT department, they would always send one therapist from each department every year. And here at Groote Schuur Hospital, Khayelitsha, we have someone at Red Cross, at the Children's Hospital, and at Tygerberg. And there's someone at George Hospital. So there's a plethora of options, even within the government sector. And in the government sector, they actually, Groote Schuur Hospital started it where they would see the patients would come in for a support group meeting once a week for 4 weeks. The first week they would learn just what is lymphedema, learn a little bit about the lymph drainage. Or I think they actually learned the bandaging the first time. And then they're taught to self-bandage. And then they come back the next week and they have to come back bandaged. And then they come and learn the manual lymph drainage. Then they come back the next week still bandaging themselves. They learn to do more massage, different techniques, as well as exercise. And then if they make it to the 4th week and they're still swollen and they need treatment, more intensive treatment, they come in for the manual lymph drainage with the therapist. So it's been a great way to educate patients, empower them, the patient, to do things for themselves. But sometimes it is hard to manage it yourself and you really need more professional help. And so they've really, put together a great program. So I'm always so proud of the government therapists. People mustn't complain about the government hospitals so much because there's amazing physios and OTs who've started some great programs in the lymphedema world within those hospitals.
Oh, amazing. Well, congratulations on all the hard work that you put in. And it sounds like you're certainly making headway and getting the messaging out there. Is there anything we need to look out for during this month?
I think there's going to be a lot of exciting programs and things. The Lymphedema Association, I'm sure, will do something, and just I think the awareness and sharing knowledge and information and tidbits of information, as well as specials on products. I think this will be a big push from all of the companies that sell different types of lymphedema compression, the garments, the bandages, and anything related to lymphedema, where there will be special pricing. So if patients, have been holding back on getting maybe a better quality product, now is the time to look into perhaps asking their therapist about getting that better quality stuff that they've been waiting for, or that they need. But as far as, I think my message is just to, if any person has swelling, they mustn't live with their swelling. There is help out there for those patients. And so, and just sharing of knowledge and information.
Wonderful. Well, thank you so much for certainly giving me a little more insight into the world of lymphedema. It's I think it's something I've certainly got to explore a lot more, and I think to have a slightly more hands-on approach and actually go and investigate what it is to treat these patients. And I might even try and attend one of your workshops or one of your training. Yeah, see what it's all about.
That would be great. We are planning on launching a whole series of Zoom type courses this year,
Okay.
and more courses even for the layperson, for patients, support like in, and for medical healthcare professionals that aren't going to be coming to get certified but are interested in learning more. So I do hope that you do attend one of our trainings in the future and maybe even meet in person at some point in the future.
Lovely. Next time I'm you're in Cape Town, yeah?
Yes, in Durbanville.
Yeah. Fantastic. So next time I'm there, I'll definitely pop in and say hi.
That would be great, Stephen.